There is immense beauty and power in trans joy. It inspires, encourages, and reminds everyone to be their authentic self. So I'm curious, what will you do to help support and spread trans joy?
Good news, everyone! Tonight, states push back, protests galore, and more. Good news starts right now. First, blue states install a fast lane for updating identity. From The Advocate. As Donald Trump denies the existence of transgender people and forbids us from updating our identity documents at a federal level, Democratic states are making it easier for us to legally change our name and sex markers. The Washington State Department of Health announced last Wednesday that it will begin expediting sex change requests on birth certificates. A process that has taken up to 10 months has now been cut down to 3 business days. Quote, "We're very proud to announce the Department of Health will now process all requests to change gender designations on birth certificates within 3 business days," wrote Democratic Governor Bob Ferguson. Previously, there was as much as a 10-month wait. A team of more than a dozen people worked through a weekend to clear the department's backlog of more than 500 requests. We're speeding up government and centering the people. Meanwhile, in Illinois, Democratic Governor J.B. Pritzker signed into law a bill that goes into effect March 1st, making name changes easier by repealing a requirement that the changes be published in a newspaper. Over 25 states, more than half of the U.S., no longer have a publication requirement. House Bill 5164 sets a 3-month residency requirement in the state in order to petition a judge for a name change, and also allows petitioners to request their name change records be sealed if public disclosure could affect their health or safety. Michael Ziri, Director of Public Policy at LGBTQ+ advocacy nonprofit Equality Illinois, said in a statement that the group, quote, "regularly hears harrowing stories from trans and gender-expansive folks about their fears, lack of privacy, and attacks, all for wanting just to live their lives. Quote, "We know this law will help people, especially in this current national moment, and this is consistent with our state's values of equality and the freedom to live our lives without harassment or harm." Similarly, Minnesota's sports governing body has said bollocks to the bullies in Washington and declared it will follow the state's law on transgender athletes, not Trump's illegal order, and continue to allow transgender athletes to compete in prep athletics. Associations in some other states signaled they may also defy the president's order, but others were taking a wait-and-see approach. The Minnesota organization said in an email to member schools that participation by and eligibility of transgender athletes is controlled by the Minnesota Human Rights Act, which contains protections for LGBTQ+ people, and in the state constitution. Quote, "The Minnesota State High School League, similar to other youth sports organizations, is subject to state anti-discrimination laws, which prohibit discrimination based on gender identity," the message said. Therefore, students in Minnesota are allowed to participate consistent with their gender identity. Trump signed his order giving the federal government wide latitude to pull federal funding from any entity that, quote, "deprives women and girls of a fair athletic opportunity," which, it should be noted, technically applies to the current executive branch of the federal government. But details. Ongoing legal challenges are expected. The California Interscholastic Federation said it complies with a state law that, quote, "permits students to participate in school programs and activities, including athletic teams and competitions, consistent with the student's gender identity, irrespective of the gender listed on the student's records. spokeswoman Rebecca Brutlag said in an email. New Jersey policy notes that, quote, during gender-separated classes or athletic activities, all students must be allowed to participate in a manner consistent with their gender identity. In Colorado, which has a number of trans-friendly laws, the High School Activities Association requires schools to, quote, perform a confidential evaluation to determine the gender assignment for trans athletes. The students and their parents must notify the school of the student's gender identity if it differs from the one they were assigned at birth. The New Mexico Activities Association said in a statement that its bylaws say, quote, participating students are required to compete in the gender listed on their original or amended birth certificate. New Mexico allows anyone over the age of 18 or their parents or guardians, if minors, to change the gender on the birth certificate. The association said it will continue to comply with state laws. The Illinois State High School Association said that their policy on transgender athletes says, quote, it allows participation by students consistent with their gender identity, subject to applicable federal and state laws, and thus they're left in a strange limbo and awaiting further guidance. Quote, we will continue to monitor any state legislation or federal guidance that impacts our policy here in Illinois and work with our board of directors to make sure that the IHSA and our member high schools remain in compliance with both state and federal law, Executive Director Craig Anderson said. Good luck to you on that, Director Anderson. The Michigan High School Athletic Association is also, quote, waiting for further clarification on potential conflicts between the executive order and the state's Civil Rights Act, spokesman Jeff Kimmerly said. The longstanding policy of the Indianapolis-based National Federation of State High School Associations is to leave such decisions up to its state-level affiliates. Quote, the governance of transgender students' participation in high school athletics programs is handled on a state-by-state basis. In many cases, state governments have issued rulings on this issue, the policy states. The NFHS does, however, support attempts by member state associations to establish policies that seek to offer competition for all students who wish to be involved in high school sports. On another battlefront established by a different illegal executive order issued by the Trump administration, protests have been breaking out across the nation surrounding access to hospitals. From Aaron in the Morning. Protests erupt across U.S. at hospitals complying with Trump's unlawful under-19 trans ban executive order. In response to children's hospitals across the country complying with President Donald Trump's recent executive order banning gender-affirming care for individuals under the age of 19, transgender rights advocates staged protests outside several of these institutions. The demonstrations, drawing hundreds of participants, shut down bustling city streets and made an unmistakable impact on local communities. Notable protests took place outside the University of Virginia Health in Charlottesville, Washington, D.C.'s Children's National Hospital, and New York University Langone in New York City, each serving as a direct rebuke of the hospital's decisions to preemptively follow an order with no clear enforcement mechanisms. The Charlottesville UVA health protest was the first to emerge in response to the new restrictions, mobilizing just 2 days after Trump's executive order was made public. Despite the short notice, organizers managed to draw over 150 people, according to the Daily Progress. The demonstration was spearheaded by the queer rights organization Charlottesville Gender Expansive Network, in collaboration with United Campus Workers of UVA, a labor union representing UVA employees. 2 days after the Charlottesville protest, demonstrators gathered in front of D.C. Children's National Hospital, with hundreds of local community members rallying for trans rights. The protests brought together parents, politicians, seasoned organizers, and trans individuals, all holding signs in clear view of hospital administrators to oppose the sweeping restrictions on care for those under 19. Less than a day later, the New York chapter of the Democratic Socialists of America staged a protest outside New York University Langone, while also launching a letter-writing campaign that has resulted in over 63,000 letters sent to the CEO and trustees of NYU Langone. This protest was among the largest, with demonstrators packed shoulder to shoulder in dense crowds along New York City's avenues. Protesters held signs displaying the contact information of NYU Langone's decision makers, urging the public to voice their opposition to the hospital's compliance with Trump's probably illegal executive order. Police were unable to disperse the protest, while a right-wing counter-protest drew only a handful of participants, their numbers in the single digits, according to eyewitnesses. These protests are unfolding amid nationwide turmoil as Trump collaborates with Elon Musk in an attempt to pressure the U.S. Treasury into manually defunding government programs that they oppose. This effort has sparked demonstrations outside the U.S. Agency for International Development, which has slashed funding to impoverished countries that rely on it for essential medical care. Protests have also erupted outside the U.S. Treasury in direct opposition to Musk's influence over the federal financial decisions. Additionally, in Asheville, North Carolina, an organically organized protest has taken shape against the heightened presence of Immigration and Customs Enforcement, ICE, following Trump's election. Protesters have faced direct opposition from local police attempting to suppress their demonstrations. These protests are part of a rapidly expanding, interconnected movement aimed at fostering solidarity among marginalized communities as the Trump administration escalates attacks on the LGBTQ+ community, Black and Indigenous people of color, and immigrants. Even among more privileged groups, there is a growing recognition that Trump's policies threaten broad swaths of the American public. The surge in protests nationwide underscores this increased unity as communities come together in collective resistance. This growing wave of resistance is evident in the numerous protests scheduled in the coming weeks, as both veteran and newly mobilized organizers coordinate actions against hospitals complying with anti-trans policies, increased ICE enforcement, and what many argue is an attempt by Trump and Musk to stage a coup on the federal government from within. In New York City, activists are planning a major demonstration in Union Square after additional hospitals, New York Presbyterian and Mount Sinai, announced compliance with Trump's executive order. In Washington, residents are organizing sustained protests outside the U.S. Office of Personnel Management throughout the week. Meanwhile, legal challenges against several of Trump's executive orders continue to mount, with some already facing federal court injunctions. The protections of marginalized communities will not come solely from elected officials or bureaucratic processes. It will come from sustained, organized resistance. History shows that real power lies not in centralized institutions, but in the collective action of those who refuse to be divided. Authoritarian governments rely on fragmentation, banking on the idea that the public will see themselves as isolated rather than interconnected. As protests grow and solidarity strengthens across movements, the coming months may test just how powerful a unified public can be. And that power is reflected in some changes already taking place. In Michigan, one healthcare provider announced that it will no longer comply with Trump's illegal executive order. From Aaron in the Morning. In an announcement last week, Corewell Health, the largest healthcare provider in Michigan, stated that it would resume gender-affirming care for transgender youth under the age of 19. The decision follows a temporary halt in services to new patients after President Trump issued an executive order unlawfully claiming the authority to withhold federal funding from hospitals providing such care. Corewell Health is the first and largest hospital system to reverse course after initially pausing treatment, a move that sparked nationwide protests against other healthcare providers that have yet to reinstate care. The hospital said in a statement that its decision was always meant to be temporary, and that decisions around transgender healthcare best belong to patients and their doctors. Quote, "We are lifting our pause on new hormone therapies for pediatric patients seeking gender-affirming care. Care decisions are best made between physicians and their patients and families. We briefly paused beginning these therapies to allow us time to assess the potential impact that recent policy changes might have on our patients and their health. The decision to reinstate care is huge for Michigan transgender patients. The hospital system is the largest in the state, employing over 60,000 people. The LGBTQIA+ adolescent page for one of the member hospital states, and stated through the closure, quote, "The adolescent and young adult medicine team at Helen DeVos Children's Hospital takes a holistic, individualized approach to patient care. We guide Michigan patients and their families through comprehensive education and an evidence-based approach. We know this is a challenging time for many of our patients and their families. No matter what is happening around us, we will always remain committed to providing high-quality care for all of our patients." Local GSM organizations in Michigan were outspoken against Corewell Health's decision to pause care, including Equality Michigan. The group is now praising the hospital system for reversing its decision. Quote, "We see this decision as one that's family-centered, equality-centered, and science-centered. The pain and confusion endured by families and young people who had appointments canceled was tragic and avoidable. The best time to make the right decision was yesterday, but the next best time to make the right decision is today. So we extend a thank you to the Corewell leadership team for righting the ship." Meanwhile, multiple lawsuits across a myriad of states challenging this executive order are moving forward, including several that have already garnered temporary injunctions. That said, while some state-level officials are taking action, some still need a little bit of persuasion. To borrow a phrase from our own Stephanie Helms, don't take your foot off the gas. Next, an update on our previous story about the 3 transgender prisoners in Washington, D.C. From NBC News, judge blocks transfers of 3 transgender inmates to men's prison. A federal judge agreed last week to temporarily block prison officials from transferring 3 incarcerated transgender women to men's facilities and terminating their access to hormone therapy under an executive order signed by President Donald Trump. U.S. District Judge Royce Lamberth in Washington, D.C. granted the inmate's request for a temporary restraining order. He issued a written ruling several hours after a hearing where a plaintiff's attorney argued that Trump's order discriminates against trans people and violates constitutional rights. The judge is presiding over the lawsuit filed on behalf of the 3 transgender women who were housed in women's facilities before Trump signed the order on January 20th, his first day back in the White House. On January 26th, a federal judge in Boston issued a restraining order in a separate challenge to the same executive order. That order was limited to the 1 transgender woman in women's prison in Massachusetts. Trump's order requires the Federal Bureau of Prisons to ensure that, quote, "males are not detained in women's prisons." It also requires the Bureau to revise its medical care policy so that federal funds aren't spent, quote, "for the purpose of conforming an inmate's appearance to that of the opposite sex." Justice Department Attorney John Robinson said prison officials have broad discretion to decide where to place inmates. Moving the women to a men's prison would jeopardize their safety and expose them to psychological as well as physical harm, plaintiffs' attorneys argued. Trump's order would also disrupt the plaintiff's access to hormone replacement therapy, which is used not only to treat gender dysphoria, but in the cases of many trans people who have been on HRT or have gone further down the road of medicalization, may be required for their health the same way sex hormones are required in every human body for normal function. Lamberth noted that there are only about 16 transgender women housed in female penitentiaries, including the 3 plaintiffs who sued in Washington. The judge concluded that, quote, "the public interest in seeing the plaintiffs relocated immediately is slight at best." Moreover, the balance of the equities and the public interest favor the plaintiffs. It's worth noting, Lamberth is a judge who was appointed by Ronald Reagan in 1987. The plaintiffs, who are identified by pseudonyms in the court filings, are represented by attorneys from the San Francisco-based National Center for Lesbian Rights and Boston-based GLBTQ Legal Advocates and Defenders, also known as GLAD Law. The plaintiffs were housed in women's units for months or years until January, when they were removed from the general population of women's prisons and segregated with other trans women to await transfers to men's facilities. Quote, "They were terrified at the prospect of these transfers given the serious risk of violence and sexual assault that they face in men's facilities," GLAD attorney Jennifer Levi told the judge. Plaintiffs' lawyers argued that Trump's order violates the client's constitutional rights to equal protection of laws and to be free from cruel and unusual punishment. Quote, "There is no way to keep these women safe outside of a women's prison," Levi said. "We are just asking this court to maintain the status quo." And we end where we begin, with more protests. This time, it's a classic. Stonewall 2, Valentine's Edition. From Aaron in the Morning. Protests erupt at Stonewall after Trump removes trans people from the monument website. Last Friday, protests erupted at Stonewall National Monument, the historic site of the Stonewall Uprising that ignited the modern gay rights movement and led to the first Pride celebrations in the United States. With less than 24 hours' notice, demonstrators gathered in response to changes made by the Trump administration to the National Park Service website for the monument. The revisions erased transgender people from several sections of the site, altering LGBTQ+ to LGB. Protesters condemned the move as an attempt to rewrite history, stripping trans activists of their critical role in the uprising that catalyzed the fight for GSM rights. Protesters chanted slogans such as "No LGB without the T," or "When they're done with us, they're coming for you. Wake up, this is your fight too." In a symbolic act of defiance, fitting for Stonewall, the National Park Service sign for the monument was altered with sidewalk chalk to read "Stonewall National Transgender Monument." Another sign proclaimed "The bricks don't throw themselves," featuring images of Marsha P. Johnson and Sylvia Rivera, two trans activists who played a pivotal role in the Stonewall uprisings and the subsequent fight for GSM rights. The protests follow a broader effort by the Trump administration to systematically erase any mention of transgender from government websites, now reaching the National Park Service. Before the recent update, the Stonewall National Monument page, reported previously here on TransPositions, acknowledged that before 1960, almost everything about living openly as a lesbian, gay, bisexual, transgender, or queer person was illegal. The revised version now states, almost everything about living openly as a lesbian, gay, bisexual person was illegal, effectively erasing trans people from the historical narrative. The edits didn't stop there. Individual pages dedicated to transgender figures instrumental in the Stonewall uprising were also altered to erase transgender references. The changes were pretty sloppy, revealing the haphazard nature of the effort and the incompetence of this administration in literally trying to rewrite history, one must note. In one glaring example, Sylvia Rivera's section, which originally stated, "At a young age, Sylvia began fighting for gay and transgender rights," was revised to read, "At a young age, Sylvia began fighting for gay and rights," with the word transgender removed entirely, rendering the sentence nonsensical. Transgender history is inseparable from the history of Stonewall. Raids on GSM bars were often justified by laws policing gendered clothing, disproportionately targeting trans people. At Stonewall, Sylvia Rivera famously stated that while she did not throw the first Molotov cocktail, she did throw the second. Transgender woman Zazu Nova is among those credited with throwing the first brick, sparking the uprising. Marsha P. Johnson, another key figure in the protests that followed, played a critical role in shaping the movement. Erasing transgender people from the Stonewall narrative is a blatant attempt to rewrite history. Stripping trans people from Stonewall's history is not just an act of historical revisionism, it is a calculated effort to erase an entire community from the very movement they helped ignite. Among the sweeping efforts to purge trans identities from government records, passports, and healthcare guidance, this stands out as one of the most blatant attempts to rewrite reality by declaration. The Trump administration's agenda is clear: to systematically erase transgender people from public life, beginning with the very acknowledgement of our existence. When a leader comes to power by demonizing a minority, and one of their first acts is to erase all official recognition of that group, it should be a blaring alarm. This is not just political posturing, it is the groundwork for something far more dangerous. Something that transgender people are intent on resisting. If you enjoy content like this, make sure to subscribe. Transpositions Weekly is the first and only weekly trans news show in the universe, and we need your support to keep this show going. Contribute at patreon.com/thetranspositions. Spread the word all over social media to let people know we're here, and tell us what stories matter to you by joining the community on Discord. Discord, of course, is where the memes live, and our meme of the week was posted by Bumblebee. And if you are looking for a sign to live your best life, join us. Also, if you have good news concerning trans people you'd like to see reported on, you can tell us about that in the Discord as well. For the Transpositions, I've been Ember Belrad.